Bismillahirrahmanirrahim. Today we'll discuss about physiology of very important event or part of life, that is sleep. Everybody enjoys sleep, right? So we'll discuss about physiology of sleep. Sleep is a period of inactivity. It is a period of inactivity during which there is unconsciousness, from which the person can be aroused by sensory or other stimuli. So a period of inactivity during which there is unconsciousness from which the person can be aroused by sensory or other stimuli. Keep in mind that unconsciousness during surgical anesthesia, coma, epilepsy should not be considered as sleep. Right? So, unconsciousness during the surgical anesthesia, coma, and epilepsy should not be considered as sleep. Sleep restores a balance between different parts of the central nervous system. It restores balance between different parts of the central nervous system. Sleep is essential for the normal life. Essential for the normal life. If a person is deprived of sleep, for 2 to 3 days, the person is deprived from sleep, then certain effects occur. And these effects include decreased mental activity, decreased or impaired mental activity, slow thought making, confusion, loss of concentration, loss of memory, and irritability. So person is deprived of sleep for 2 to 3 days. The effects appear, which include impairment of the mental activity, slow thought making, loss of concentration, confusion, loss of memory, and irritability. If this sleep deprivation is further prolonged, then there may be abnormal walking, dysarthria, a speed disorder, and there may be tremors. So you have seen that the sleep deprivation results into these effects in human beings. Now, regarding the requirement of sleep, it varies with age and varies with individuals. Now, in newborn babies, the sleep requirement is 18 to 24 hours. So newborn babies, the sleep requirement is 18 to 24 hours. In young children, it is 12 hours. In the adults, 7 to 9 hours. In old age, 5 to 7 hours. In old age, 5 to 7 hours. These are the requirements of sleep. Now in adults, the requirement is 7 to 9 hours, but it varies with individuals. Some individuals are satisfied, say, with 5 hours sleep. Some may not be satisfied with 7 hours, 8 hours. So it varies with individuals. Everybody enjoys during a night 2 types of sleep. So 2 types of sleep everybody enjoys during the night. The first type is the slow wave. Slow wave sleep, also called delta wave sleep, also called non-REM sleep. That is non-REM sleep. REM is rapid eye movement sleep. So slow wave or non-REM sleep, REM sleep, that is the rapid eye movement sleep. And the second type is REM sleep or rapid eye movement sleep. Rapid eye movement sleep or REM sleep, also called paradoxical sleep. Paradoxical sleep. Paradoxical sleep. So these are the 2 types of sleep: non-REM sleep, slow wave sleep, and then REM or rapid eye movement sleep. So first about the slow wave sleep. Delta wave sleep, also called non-REM, non-rapid eye movement sleep. It is deep, restful sleep. Deep and restful sleep. It is about 75% of the total sleep. It is about 75% of the total sleep. And this sleep is deep and restful. A person who is much tired, goes to deep sleep within 1 hour. So a person who is much tired goes to the deep sleep within 1 hour after going to the sleep. Now in this sleep, dreams may occur. Dreams may occur, but these cannot be remembered. So dreams may occur, but these cannot be remembered. In the EEG, there are delta waves. So in the electroencephalogram, the waves are delta waves. So delta waves are present during deep or slow wave sleep or non-REM sleep. There is growth hormone secretion. There is growth hormone secretion during slow wave sleep. A slowing of the heart rate, respiration, slowing of the heart rate, respiration, muscle tone decreases, BMR decreases by say 10 to 30%. So decrease BMR 10 to 30%, right? So these are the features of the non-REM sleep or slow wave sleep. So deep, restful sleep, it constitutes about 75% of the total sleep. Dreams may occur, but these cannot be remembered. There is growth hormone secretion, delta waves in the EEG, right? Slowing of the heart rate, respiratory rate, decreased BMR by 10 to 30%. Muscle tone decreases. So these are the features of the non-REM sleep or slow wave sleep. The second type of sleep is REM sleep or rapid eye movement sleep. REM sleep or rapid eye movement sleep, also called paradoxical sleep. So this sleep occurs in episodes. It occurs in episodes, each lasting for 5 to 30 minutes. 5 to 30 minutes and repeated every 90 minutes. Repeated every 90 minutes. So I told you that REM sleep, rapid eye movement sleep, occurs in episodes. Each episode lasting for 5 to 30 minutes and repeated every 90 minutes. There are 4 to 6 episodes or periods during a REM sleep during a night. So 4 to 6 episodes of REM sleep during a night. And REM sleep constitutes about 25% of the total sleep. It constitutes about 25% of the total sleep. REM sleep is more in old people as compared to young adults. So in old people, more REM sleep as compared to young adults or children. If a person has taken rest before going to sleep, there will be more REM sleep. So more REM sleep if a person has taken a rest before going to sleep. Now during REM sleep, EEG shows beta waves. Beta waves are present during REM sleep in EEG. And you know, beta waves indicate highly active brain. Beta waves indicate highly active brain. So it means during REM sleep, brain is highly active. In REM sleep, brain is highly active. So it is called paradoxical sleep. It is called paradoxical sleep because brain is highly active during REM sleep. There is active dreaming during REM sleep, and dreams can be recalled. Dreams can be recalled. So active dreaming occurs in REM sleep, and dreams can be recalled. It is difficult to arouse the person from REM sleep. It is difficult to arouse the person from REM sleep. Or you say, threshold of arousal is higher in REM sleep. Threshold of arousal is higher in REM sleep. But it is interesting to know that most of us wake up in the morning from REM sleep. Most of us wake up in the morning from REM sleep. We are enjoying some dream, we wake up. Although it is difficult to arouse the person from REM sleep, but most of us wake up in the morning from REM sleep. During REM sleep, there is rapid eye movement. Rapid eye movement. There may be twitching or jerky movements in the body. There may be twitching or jerky movements in the body. Muscle tone becomes very low. So low muscle tone. decreased muscle tone. Stretch reflex cannot be elicited. Stretch reflex cannot be elicited. Cannot be elicited. Respiration and heart rate becomes irregular. Respiration and heart rate becomes irregular. There may be bruxism. Bruxism during REM sleep. Bruxism means teeth grinding. So teeth grinding or bruxism occurs during the REM sleep. During REM sleep, there is secretion of corticosteroids and testosterone. So there is secretion of corticosteroids and testosterone during REM sleep. In males, there may be erection during REM sleep. In males, there may be erection in the REM sleep. Right? So these are the features of the rapid eye movement sleep, which constitutes about 25% of the total sleep. It occurs in episodes, each lasting for 5 to 30 minutes, repeated every 90 minutes. Right? There are rapid eye movements. There may be jerky movement, twitching in the body. EEG shows beta waves, which indicate highly active brain. There is active dreaming, and dreams can be recalled. Dreams can be recalled. Our REM sleep duration is more in older people as compared to young adults or children. If a person has taken much rest before going to sleep, then the REM sleep will increase in duration. During REM sleep, beta waves are recorded in the EEG, very decreased muscle tone, irregular heart rate and respiration, and stretch reflex cannot be elicited. Right? So these are the features of the REM sleep or rapid eye movement sleep, also called paradoxical sleep. This figure shows changes in EEG when a person goes to sleep. You see, when person is wakeful, alert, in the EEG, which waves are present? Beta waves. So beta waves are present when a person is alert, having wakefulness. When a person wants to go to sleep, he will go to a quiet room. Will close his eyes. Will become mentally relaxed. And in the EEG, the waves will be alpha waves. Person is awake but quiet. So this is the quiet wakefulness. The person is in a quiet room, mentally relaxed, eyes are closed. So he's having quiet wakefulness, and in the EEG, there will be alpha waves. Then person passes to deeper sleep. The theta waves in the light sleep, theta waves appear in the EEG. In the light sleep, theta waves. And then in deep sleep, you see delta waves are recorded in the EEG. So during deep sleep, delta waves are recorded during deep sleep or slow wave sleep. But then during REM sleep, which we have to see? Beta waves. So beta waves are recorded during REM sleep, rapid eye movement sleep, indicating that the brain is highly active during REM sleep. There is a cycle between wakefulness and sleep. A cycle between wakefulness and sleep. When the person remains awake for many hours, neurons in the reticular activating system becomes gradually fatigued. When a person remains awake for many hours, the neurons in the reticular activating system becomes fatigued. Moreover, certain sleep centers are activated. And this results into sleep. So fatigue of neurons in the reticular activating system and stimulation of certain sleep centers in the brain, it results into sleep. During sleep, the neurons of a reticular activating system regain excitation, they become again excitable, and certain centers are inhibited, resulting into wakefulness. So cycle of wakefulness and sleep occurs, right? Now, certain parts of the brain are involved in two types of sleep. The first in the involvement of the brain centers in the slow wave sleep or deep sleep. The first center is Raphe nuclei. Raphe nuclei are thin midline nuclei. These are thin midline nuclei present at the junction of the pons and medulla oblongata. Nerve fibers from here go to the reticular formation, thalamus, hypothalamus, and other parts of the limbic system. So nerve fibers from here, these go to reticular formation, hypothalamus, thalamus, and other parts of limbic system. Nerve fibers from here also go to the dorsal horn spinal cord, to the pain inhibitory complex in the dorsal horn of the spinal cord. So nerve fibers from Raphe nuclei also go to the pain inhibitory complex in the dorsal horn of the spinal cord. Nerve fibers from Raphe nuclei release serotonin at the nerve endings. Serotonin. So when we stimulate Raphe nuclei, there is sleep. And which neurotransmitter is involved in the slow wave or deep sleep? Serotonin. Right? So serotonin is the neurotransmitter involved in the slow wave or deep sleep. Now when we give some serotonin inhibitor or antagonist, we give serotonin antagonist to a person, there will be loss of sleep and there will be increase wakefulness in the person who receives some serotonin antagonist. Increase wakefulness in the person who receives serotonin antagonist. The next part of the brain involved in slow wave sleep is anterior hypothalamus. Anterior hypothalamus, especially the suprachiasmatic nucleus. So anterior hypothalamus, especially the suprachiasmatic nucleus. Another part of the brain involved in the slow sleep is parts of the nucleus of tractus solitarius. Parts of the nucleus of tractus solitarius. So if we stimulate parts of the nucleus tractus solitarius through rapid nuclei, they will be slow wave sleep when you stimulate parts of the nucleus of the tractus solitarius. So this was about the parts of the brain involved in slow wave sleep or deep sleep. Now parts of the brain involved in REM sleep, rapid eye movement sleep. Locus ceruleus. Locus ceruleus is present at the junction of the pons and midbrain. So at the junction of the pons and midbrain, there is locus ceruleus. And nerve fibers from here go to reticular formation, and other parts of the brain. And these nerve fibers release norepinephrine at the nerve endings. So these nerve fibers release norepinephrine at their nerve endings. And this locus ceruleus is involved in the REM sleep, rapid eye movement sleep. And the neurotransmitter of the locus is norepinephrine. Large acetylcholine secreting neurons in the upper brain stem are also involved in the REM sleep. So large acetylcholine secreting neurons in the upper part of the brain stem, these are also involved in the REM sleep. So large neurons which secrete acetylcholine and which are present in the upper part of the brain, these are also involved in the REM sleep. Our research has been carried out in animals, and it has been found that if animals are kept deprived of sleep for some days, a sleep factor is released into CSF of the brain stem, and this sleep factor then appears in the blood and urine. And when this sleep factor is injected into another animal, they will sleep. Right? So the animal is kept deprived of sleep for many days, or for some days. A sleep factor appears in the CSF of the brain, then it appears in the blood and urine. And when this CSF is injected to other animal, they will sleep in that animal. And one of these sleep factor has been identified chemically, and it is called muramyl peptide. Muramyl peptide. So one of the sleep factors has been identified chemically. It is called muramyl peptide. Muramyl peptide. So this was about the sleep mechanism, its types, and parts of the brain involved in the sleep. Now briefly about the disorders of the sleep. Disorders of the sleep. The first disorder is sleepwalking or somnambulism. Sleepwalking or somnambulism. You must have heard that some people, some young males, they have sleepwalking. So during sleep, they start walking. They walk for say many minutes. A person is sleeping in the first floor of the building, may come down and then can go back. Right? So this sleepwalking continues for many minutes. And the apparently eyes are open. The person avoids obstacles. The person avoids obstacles. Eyes are open. And when the person wakes up, he cannot recall the episode of sleepwalking. When the person wakes up, he can't recall the episode of sleepwalking. Sleepwalking somnambulism is more common in males. In male boys, male young adults, it's more common. So it's somnambulism or sleepwalking. Bedwetting occurs in young children, small children, bedwetting. It is called nocturnal enuresis. So nocturnal enuresis or bedwetting occurs in small children. Now both the somnambulism and nocturnal enuresis, these occur during slow wave sleep. So both these disorders occur during slow wave or deep sleep. The other sleep disorder is narcolepsy. Narcolepsy. In narcolepsy, there is intense desire to sleep during daytime, which cannot be resisted. So intense desire to sleep during daytime, which cannot be resisted. This episode may last for seconds to minutes. It may last for seconds to minutes. The person is talking. Suddenly, the person goes to sleep. He can't resist the intense desire to sleep and goes to sleep. Narcolepsy is considered to be due to hypothalamic disease. It is thought to be due to hypothalamic disease because the other features of hypothalamic disease are present. Because the other features of the hypothalamic disease are present. Say obesity, sexual retardation, polyuria, disturbance of behavior. So these features are also present in addition to narcolepsy in hypothalamic disease. Other sleep disorder is sleep apnea syndrome. Sleep apnea syndrome. In certain individuals, there is sudden arrest of breathing. So a sudden arrest of breathing occurs during sleep. There is a sudden apnea during sleep. And there is apnea. The person wakes up, tries to have a breath, again tries to go to sleep, again there is apnea. So in severe cases, it may be repeated hundreds of times. In severe cases, the sleep apnea may be repeated hundreds of times. In the morning, of course, the person is lethargic, drowsy, irritable. In severe cases, the person has features of respiratory failure, of course, no lung disease. In severe cases, the person may have features of respiratory failure with no lung disease. With no lung disease, in sleep apnea syndrome, exact cause is not known. One possible factor is obesity. Airway obstruction, or disease of the central nervous system. So the causes of sleep apnea syndrome include airway obstruction, obesity, and disease of the central nervous system. The other sleep disorder is insomnia. Many of us, they have insomnia, loss of sleep. So insomnia is insufficient sleep, although opportunities of adequate sleep are available. So insufficient sleep, although opportunities of adequate sleep are available. Very comfortable bed, very comfortable room, quiet room, right? But sleep is not there. So insufficient sleep, although opportunities for adequate sleep are available. It is due to some medical problems or maybe due to some psychological problems. So this was about the disorders of the sleep.